Hello guys, good morning, good afternoon, good evening, wherever you are watching me from. How are you all doing? Today I'll be sharing with you family planning. So what is family planning? Family planning allows people to attain their desired number of children and to determine child spacing, and it can be achieved through the use of contraceptive method and the treatment of infertility. So this family planning help to reduce mother and child mortality, that means mother and child death, in 20 to 30%, and it can also be used to prevent unwanted pregnancy. So this family planning, the reason why they are doing family planning is to space children from 0 to 2, so your children will be two years different, so that parents income can able to be spent on 2 or 3 children than a large family, because a large family, now that everything is hard, you can able to train up your children in 2 or 3 family. So, and children can able to attend better school, feed well, and be taken care of by their parents. And also children, to prevent child stillbirth and to prevent child premature death. So this is the reason. So let's know the type or the method of family planning. So the number one method is injectable. This injectable is hormonal, and it is 91 to 94% effective. It lasts to 3 months. The side effect is irregular period and weight gain. So this one is a long period of effectiveness. So the other method we are going to is implant. This implant is inserted under the woman's skin of the upper arm, and is 99% effective, and it can last up to 3 years and above. Another problem is irregular period. This is the side effect, and a woman with cancer, that has cancer, cannot make use of this implant. So the other method is the use of pill. The use of pill, this one is a daily taking of medication. So it's 91 to 94% effective. And this woman, the side effect, the only problem is the woman can forget to take this drug, and which can result to pregnancy, and this is what we are avoiding. So the best thing to do, if she notice that she forgot to take it, she can take it the moment she find out. And also, if she notice that during her intimacy with her husband, during her ovulation, she can also take this emergency medication to prevent pregnancy. So the other method is the use of IUD. This one is a form of T copper, a form of T shape. This device is inserted into the woman's uterus by the doctor, and is 99% effective. It can last from 5 years to 12 years, depending on the individual's body and depending on the copper. There are different copper, the one of 5 years, the one of 12 years. So depending on how long you want to space your child. And this can cause irregular period and spotting, and can cause cramping each month. So this is a very good method. So the other method is the use of surgery. We have sterilization, which is the use of tube, that means the woman fallopian tube, is cut off and is 99% effective, and this require surgery. And the other one for the man, this one requires vasectomy. So this man, they will cut off the tube where carries the sperm, and is 99% effective, and it lasts long. So the woman that cut off the fallopian tube and the man that cut off the tube that carries the sperm require surgery, and this one lasts till the man and the woman dies, or except it takes the grace of God for this family to have another children. It can only be God. So the last part of it is the use of ring. So this one, we have the ring, we have the diaphragm. They work hand to hand together. So this one, they insert it into the woman body, into the woman vagina once in a month. But this is effective, 91 to 94% effective. This diaphragm or the ring can shift. You understand? It can shift and can result to pregnancy. So the woman will change it every month. And the other one is the use of female condom. This female condom can get burst, or the man condom can get burst, which is what we are avoiding. So if you get burst, please, the woman should take the emergency pills that I told you before. So I would also like to tell you how you can do calendar method. This calendar method is very, very effective. This is when you will monitor your body, monitor your ovulation, monitor your menstruation. So let's get started. For example, the woman menstruates for 4 days or 5 days. This woman's cycle, for example, is 28 days. So from the 5th to on the 9th, she will have intimacy with her husband without using condom, because that day is dry days. So from the 10th till on the 14th is her fertile days, but on the 14th is her ovulation days. So she will meet her husband by using condom. So because on the 14th is her ovulation day. From on the 15th till on the 19th, if she want to meet her husband, she will also use condom. So from on the 20th till whenever she see her menstruation, she can meet her husband without using condom. But this on the 14th is her ovulation day. For women who have 30-day cycle, her ovulation day is on the 16th. For example, she menstruates for 4 days or 5 days. 4 or 5 days menstruation. So from on the 5th till on the 10th, she will meet her husband without using condom. But from on the 11th till on the 16th, she will meet her husband by using condom, because that day is her ovulation day. From 11th to on the 16th as ovulation day. But from the 17th to on the 21st, she will use condom. But from 22 to whenever she see her menses again, she will not use condom. For example, another one is when the woman cycle is 32-day cycle. So for example, 5 or 4 days menstruation or 4 days. So from on the 6th till on the 12th, she can meet her husband without using condom because it's her dry day. From on the 13th till on the 18th, she will use condom because on the 18th, from on the 13th till 18th is her fertile day. From on the 19th till on the 23rd, these days she will also use condom. But on the 24th till whenever she see her menstruation, she will not use condom. So remember, on the 18th is her cycle. She can only notice this by her ovulation, her discharge, whatever, that egg white. Whenever she see that egg white, those days are her fertile period, and she will use condom. So if you don't understand, play it back, and so that you will understand whatever I'm explaining over there. This calendar is very trickish. You have to settle down and calculate it very well. Knowing your body is whenever you see an egg white secretion coming out from your body. So those days is your fertile days, and if you don't take time, if you don't use condom during those days, pregnancy can occur. Please, I want to inform you, this method, whether calendar method or other method that I have explained before, please let your husband be aware. Let your husband know everything that is going on. Do not do it without your husband notice. And please do it in a hospital. Hospital is not a quack hospital or a quack doctor or quack nurse, or you went to a pharmacy to get anyhow drug. Please know your body. Your doctor will tell you this is good for you and this is not good for you. Please, before doing any of this method, like I said, let your husband be aware so that you will plan ahead. You will plan together so that it will not be as if you are commanding him, this day I don't want to use condom, this day I want to use condom, so that he will be aware that we are doing family planning. Please, thank you so much. And if you find this video very interesting, please like, share to your friends, share to your family. And if you have any question, maybe there are question that is bothering you, or you know any of this family planning, which of this family planning you are using, please comment down below your question, and also tell me which of the family planning you are using. Thank you for staying behind. See you some other time. Bye bye.